And what happens is they don't know to go to a chiropractor, right? They go to their medical doctor and they have the pills and this sort of stuff and they start to feel a little bit better. But they never got that joint mobility and get those things functioning properly. And I think what's happening is this degeneration is happening because they never got the chiropractic care to restore that flexibility and mobility. So that's one of the things that's important that we need to do.
All doctors like to hand out pills.
Well, in one of my slides, a medical doctor stands for more drugs.
Yeah.
MD, right? More drugs. I mean, that's in their name is medical doctor, right? They give medicines. I mean, that really is. But if we understood that and actually, not to be critical. I mean, I can't give medicines, right? So when we need a medicine, then we need a medical doctor, right? That sort of thing. But most of the time, most of what we need, really, we don't need more medicine. We need to have our body fixed. All right. So then, if we talk about innate intelligence, and these are, so I threw out a word subluxation, and chiropractors use that. That's a misalignment of the spine that puts essentially abnormal pressure. It causes where it's no longer lined up properly. And if that happens, then that's one of the problems. Well, I said then that it alters the innate intelligence. Well, innate intelligence, if we think about chiropractic, at the moment of conception, the sperm and the egg come together forming you, right? And you are completely a new being inside of your mom. And that embryo doesn't need any help. Do you realize that embryo, that God has set in motion a series of events, that little embryo is going to turn into a full-fledged baby and will be born in 9 months, right? Well, about day 14, something happens. Instead of all those, the sperm and egg combine forming a cell, then that divides, forms 2, and then 4, then 8, and so forth. And it's kind of like a raspberry, right? Well, all the cells are the same for the first couple weeks. They just replicate, make more and more of the same. But something happens about between day 14 and 16, in that time frame, something happens, and that's called differentiation. And what happens then, the new cell starts to form that's different from all the others. Ultimately ends up being the nerve system. Now, the reason it's the nerve system is if it were, let's say, most people might say, well, maybe my heart's the first thing to form. Well, no, it can't be the heart, because if the heart were to form and there weren't any intelligence or any communication neural network, there would be no control of the heart. That wouldn't make any sense. The first thing you've got to have is some sort of a network of communication. And then, like a tree, the fruit grows off of the tree. You need to have the tree on which that fruit can grow. So if you think about your organs, and so this is an important idea, because I think it is a response of your innate intelligence that I believe is good for your survival, but not for your best, right? This is why I think that solidification, your innate intelligence has decided the best thing to do is to make you strong, okay? But strong means not moving. It doesn't think that's a problem, right? It's trying to fix this problem that it perceives, all right? So that embryo, and it continues on, and so the problem is if interference is introduced into your body, that's where the problems come. Now, when we're born, we have a C curve. We all talk about the fetal position, right? We curl. So if we were to look at a little baby, they're just like this. Well, one of the things in the crux of the arthritis conversation is we're going to talk about your neck curve. Your neck curve did not exist, it formed. When do you think your neck curve formed? No, it happened after the baby was born, so after the 9 months. Have you ever noticed little babies who are laid on their tummies, what do they start to do? Raise their head. Because we have to think about what is something that will actually because the curve is supposed to go this way. When we're born, we're all tucked up like a little fetus, like this, right? So we have to have a neck curve that goes like this, and it forms after the baby has been laid on their tummy, and they start to lift their head as wobbly, looking around. That's a secondary curve, right? So a primary curve is one that we have when we're born, which would be just that C curled up fetus. The first secondary curve is the neck. What would be the second secondary curve that forms? Lumbar, your low back. Yeah. When does that form? What's that?
Start trying to get up.
Yes, when we start to, it's essential for us to walk, right? So a little toddler is typically when it starts to form. And so it's kind of interesting when we think about these curves, they then become important, because one of my theories is that if something happens to cause a loss of your cervical curve or lumbar lordosis, that is going to be one of the things that allows the stress to converge in a place in an abnormal place and cause a focused and specific arthritis to form. And this would be more than degenerative arthritis, right? So that we had to understand, oh, I'm supposed to have a curve, that sort of thing, and this, when did it form in me? So if that's when it formed in me, then when did I lose it? And that's why I say, well, what traumas were you in, car accidents or anything like that? Because this, and even so people, oh, that was 20 years ago. Why? I say, that could have been, it looks like it's long enough, that might have actually been when it all started, right? Even though you weren't having symptoms, I'm looking at what started the cause of the arthritis, that sort of thing, not when any symptoms started or anything. All right, so, and if people think about my hands, because like my hands are what I'm, it hurts, that sort of thing. Well, if I were to say, and not to say that I don't care about your hands, because I do care about your hands, and we'll adjust them, we'll do those sorts of things, right, to help them, right? But if I had to say, if should I be more worried about my arthritis in my hands or arthritis in my neck?
Probably your neck.
Your neck, and why?
Sure. That's
It's on your spine.
Yes, because it is the neck forms a conduit through which your entire intelligence system flows, right?
Sure.
And if it starts to deteriorate, and those bone spurs start to grow out, and they start to grow into compressing some of the space, you want a big fat donut hole. You don't want any of that donut hole filled in by that corrosion stuff, the cauliflower stuff, right? So if you have degenerative arthritis that starts forming in your neck and it starts growing into anywhere where those nerves are, that's bad news for the body, right? And that's tough, right? So that's why, so I would say then that we really need to make sure that we pay close attention to really to the neck or to the back, anywhere where the nerves are. So those are, in my opinion, more important than the knees and the hands and shoulders, that sort of stuff. Although we still want to address it where we find it, but we've got to make sure we keep the priority. So the curve, what does the curve do? And it adds shock absorption, it adds strength. So if you have a nice curve, it allows a springiness to your neck, your head, which weighs a bowling ball. If we have a straight neck, essentially all that force will pound like a pile driver, right? And it puts a lot of pressure, and especially in the lower neck. We've got some X-rays, and we'll be going over that sort of thing. Strength, a curve is much stronger than a straight thing in terms of just from a physics standpoint. And it allows, and probably the most important thing is it allows your spinal cord to be in a relaxed state. Alf Briggs did some research where he looked at a curve reversal, and your spinal cord stretches between 2 to 3 inches to bend around that versus a nice curve. All right, so it's really important. All right, so there was a study that was done, and we'll talk about that because I find this really fascinating. The question is, this is specifically they were looking at necks, and what they asked is they lined up all these people and they said, okay, what bones? Where are most of the spurs? All right, so they kind of like C2, hardly any. C3, a little bit. C4, C5 is the winner. And C6 and C7. Why is C5?
where is C5?
That would be right where your collar crosses, kind of in the lower part of your neck.
Okay.
Why there? What we'll find, the stress convergence. If we look at when we're supposed to have this curve or straight, almost all of the force converges in this region when we have a straightening of our neck. Okay, that's ultimately what ends up happening. And so this is something it looks at, and this actually one of my patients did this for us, which was really nice. Do we? Oh, there we go. Okay. But essentially C5, and so I want you to see this because remember what we talked about. If it's not age, if it were age, they would all of these discs would have spurs, right?
Yeah.
Because they would, you're getting older, so you're getting spurs, right? The data doesn't support that. It's C5, predominant, C6 and C4, that cluster in that lower neck, and what we'll find is it has to do with the fact that when your neck becomes straightened, all the forces converge there. So that's an interesting thing. Now this then is the next thing. This bad boy is really convicting to me. So they said, well, when did they form?